Okay, good afternoon. It's Monday, September 13th at 4:30. I'd like to call this public hearing to order. This is a public hearing regarding the Public House proposed FY22 budget and appropriation ordinance 2021-09-01. May I have a roll call to bring us to into the hearing?
Andy Kornstrom,
Yes.
Darlene Kleppel, Daniel Chenoweth.
Present.
We do have a quorum. Is there anybody in the audience that would like to speak to this body regarding our proposed FY22 budget and appropriation ordinance? I will ask one more time. Is there anybody in the audience that would like to speak to the FY22 budget and appropriation ordinance? And seeing nobody else, one more time, anybody like to speak to the appropriation ordinance? Hearing none, we can now close this public hearing. As Ruth, do I need a roll call to close it? Do you know, Danielle?
I don't know.
We'll do a roll call just to close it, I guess, just to be sure. May I have a roll call vote to close the public hearing?
Roll call, Andy Kornstrom,
Yes.
Darlene Kleppel, Daniel Chenoweth.
Yes.
Okay, the public hearing is now closed. We're now going to move on to our monthly meeting. It's Monday, excuse me. We closed the hearing at 4:31. We'll move on to our monthly meeting. It's 4:31 as well on Monday, September 13th. I'd like to call the monthly meeting to order of Champaign-Urbana Public Health District's board. May I have a roll call, please?
Andy Kornstrom,
Yes.
Darlene Kleppel, Daniel Chenoweth.
Yes.
We are in our meeting. Approval of agenda, please.
So moved.
Second, any discussion? All those in roll call, please.
Andy Kornstrom,
Yes.
Darlene Kleppel, Daniel Chenoweth.
Yes.
All right, that is approved. I bet Josh would appreciate if we had shorter names. Approval of minutes from the August 9th, 2021 meeting.
So moved.
Second, any discussion? Roll call, please.
Andy Kornstrom,
Yes,
Darlene Kleppel, Daniel Chenoweth.
Yes.
that's approved. Any public participation? Is there anybody in the audience that would like to approach the body for any business? Hearing none. Correspondence?
I have nothing.
Wonderful. Old business, I see none. New business, treasurer's report. Ron?
Yeah, as of the end of July, which was the first fiscal month of the year, showed cash on hand at $6,635,731. The fund balance was at a little over 6.4 million, which is 36% of the budgeted expenditures for the year. The end of the month, we had a surplus of 20,851. And then within that report, I said the annual budget, it should be the proposed annual budget, 17.7 million, which has a proposed operating net of a negative 750,000. The income revenue for that first month was just over $1 million, $1,008,196, which is 615,000 under what is the proposed budget. The property taxes were about 15,000 over the annual proposed budget. Grants and contracts are the ones that were behind as usual during the COVID time, 625,667. Expenditures were just about $1 million. Again, 987,345. The biggest expense that was on the downside was capital outlay, and I understand there was a budgeted expense that was anticipated to be expended in July of a mobile unit that was not in July.
Thank you, Ron. Any questions for the treasurer? Okay. Approval of payments to Board of Health appointees. I'm just going to place these all together. Treasurer Ron Fields in the amount of $460.20. Check request number 2290. Attorney Ruth Wyman, it's a ratification to correct the August board approval on 8/9. The actual payment matched the sorry. So we're ratifying this. You know what? I'm gonna do these separately. My apologies, just because it's a little more complicated. So I'd entertain a motion to approve check number 2290 in the amount of $460.20 for Ron Fields.
So moved.
Second, any discussion? All those in favor?
Aye.
Aye, opposed? You know what? Sorry. It's been, Danielle did all the,
I know, you gotta do the
Zoom
roll
meeting.
call.
yeah, roll call, please. My
If
apologies.
Ruth was here, she'd wrap your hands with it.
I gotta get used to this.
Andy Cornstrom,
Yes,
Darling Klippel, Daniel Chenoweth.
Yes.
that motion passes. Ruth Wyman, this is ratifying a previous board approval on 8/9. We approved a check request for 625. The actual payment, I'm not really sure. Amanda, do you want to speak to exactly what we're doing here? It's a little confusing based on
So what happened is I guess there was a misunderstanding. Sorry, Josh. Josh was putting the agenda together and didn't realize that he was supposed to take the amount from finance team. He's seeing the invoice 625 is what he thought he saw, and he took that when really the invoice was only $50 and the 625 was like for a payment or something. So I just wanted to get that on record that we actually paid what we were supposed to pay,
okay.
even though it wasn't what the board approved.
Okay, so we're just retroactively ratifying then that payment. Is that right?
In effect, yes.
Okay. Thank you. I'm sorry. That was I just wanted to clarify. So we're effectively retroactively approving the payment of check number 2089 for $625. Is that
It
accurate?
is actually $50.
Okay. So we're approving
Changing what the initial approval was supposed to be to what it actually was.
okay. Still the same check number though?
Yes.
Okay, so
Well,
2089,
that's the Paramount check request number.
okay, for $50.
Yes.
My apologies. Okay. So I would entertain a motion to pay that approval or that check request number 2089 for $50.
So moved.
Second,
Second.
and I
I've
think
actually joined the meeting, Andy.
hi, Darlene. Can we, Joshua, can you note that Darlene is
Joined at
yeah.
436 is what I have it as.
Okay. Thank you. Any discussion on this motion? May I have a roll call, please?
Andy Cornstrom,
Yes.
Darling Klippel,
Yes.
Daniel Chenoweth.
Yes.
Okay, that motion passes. And Ruth Wyman ratification check request 2194 for legal services between 7/26/21 and 8/13/21. You guys are really trying to
So
kill me
basically
here.
what happened with that one is, I don't know how it happened, but Andy, you actually approved her check request before it went to the board, and I told you to sign it.
Okay. So this again is just retroactively approving a check
Yes.
request in the amount of $875.
Yes.
Okay. I would entertain a motion for that.
So moved.
Second, any discussion? Roll call, please.
Andy Cornstrom,
Yes,
Darling Klippel,
Yes.
Daniel Chenoweth.
Yes.
that passes. Thank you. All right, now we're going to the easy stuff. Approval of a refund of unused grant funds for FY 2021 to the Illinois State Board of Education in the amount of $246,856. This is check request 2176.
So moved.
Second, any discussion?
Can we just get a brief explanation for why we're returning these funds?
Absolutely. I don't know who, would that be Julie
Andy,
or
you're
Amanda?
muted.
I am muted.
No, Julie's muted.
Oh,
Mandy.
Mandy,
Mandy,
you're
you're
still
muted.
muted.
You're
Oh,
muted.
Andy.
Mandy, you're muted. Mandy,
There you go.
I give up. I'm not talking. I don't really think I have a lot of information on it, other than this is a State Board of Education grant that, if I remember right, is for, oh, Julie, what's that called?
It
It's
should be
Tasha's
the,
Is
grant.
it the prep grant? Is it Whitney's?
No, Tasha's. It used to be Tasha's. Um,
Oh, is it,
Healthy Beginnings.
yeah, I couldn't think of the name. Is it Healthy
Yeah,
Beginnings or
that-
Great
I think
Beginnings?
that's
or-
the legal name of it, early beginning, but anyway, it's just a grant that they pay us up front during the year, and we frequently do not use all of the money, so we're paying it back. They always send us a request wanting that money back at the end of the year.
So the grant is for, it's from maternal and child health.
No, it's, well, yes, it is.
Okay, and what does it pay for?
That is, I can't explain that.
Oh, it's the home visiting grants. It's a high-risk pregnancy grant. We never get the caseload that they assign to us. That's meaning
Okay.
that they give us more money than we're gonna ever have caseload. A couple of grants do that. They don't really listen to how many we think we're gonna have, and then we have to send it back, so.
Is it that, do we have case managers that would be able to take the load, or is it that we're constrained by our staff?
No,
Or is it
we just don't have them that.
Actually, what they do is they hire in more case managers as their load goes up, but they have not. I mean, I think they've only hired like maybe 3 now.
Mhm. Yeah, but I don't think
they
it's
don't
a-
have the load for it.
right, because it's not a problem of finding case managers. It's a problem of caseload, I believe.
There just aren't the clients.
Right,
to-
it's real specific. There's a ton of these programs in our community, and that's kind of the problem. They're everywhere. They, rather than, kind of focus on just a few places, they ended up giving these out all over the place, and even to other communities who are coming into our community. So it's kind of strange, but
Mhm. Could someone send me the criteria for that program? Because you're talking about pregnant women who are in need of home visits, and maybe they have to have high-risk pregnancies as per a doctor's order, but I would be very interested in finding out more about that program.
mhm,
I
yep,
mean, yeah, so,
Yeah.
and
Are you taking care of that, Julie?
yeah, I will.
Thanks.
thanks so much.
And by I will, I mean, I'm gonna email Brandon and tell him to.
That's what I would do.
Because he has that's in his division.
Okay, great, thank you.
Any other discussion on the motion? Hearing none, excuse me, roll call, please.
Andy Cornstrom,
Yes,
Darlene Kleppel,
Yes.
Daniel Chenoweth.
Yes,
that motion passes. Thank you. Review of monthly credit card statement. Does anybody have any questions or concerns on the monthly credit card statement?
No.
Hearing none, may I have a motion just to adopt and place on file?
Andy
moved.
Cornstrom. Oh, sorry.
No, that's okay. Motion, I'll second. Any discussion? Roll call, please.
Andy Cornstrom,
Yes,
Darlene Kleppel,
Yes.
Daniel Chenoweth.
yes,
thank you. I'd entertain a motion to adopt the FY 2022, 2021, 2022 budget and appropriation ordinance 2021-9-01.
so moved.
Any discussion? Thank you. I know there's a lot of work that goes into preparing this, and so thank you for that work. And I'm sure COVID hasn't helped with the types of funding and the variables. So thank you for all that. If there's no other discussion, roll call, please.
Andy Cornstrom,
Yes,
Darlene Kleppel,
Yes.
Daniel Chenoweth.
Yes,
that passes 3-0. Approval of lease amendment between CUPHD and the University of Illinois for Unit 13 Nutrition Education Program to extend the term of the lease for the period of January 1st, 2022 to December 31st, 2022.
so moved.
I'll second. Any discussion? Hearing none, roll call vote, please.
Andy Cornstrom,
Yes,
Darlene Kleppel,
Yes.
Daniel Chenoweth.
Yes,
thank you. That passes 3-0. Approval of addendum to lease agreement between CUPHD and Community Health Partnership of Illinois.
Second.
Motion and a second. Any discussion? Hearing none. Roll call, please.
Andy Cornstrom,
Yes,
Darlene Klippel,
Yes.
Daniel Chenoweth.
Yes.
that passes 3-0. Discussion and approval of CUPHD's competitive bidding packet. I think Pat's on the call.
I am.
Hi, Pat.
Hi. Any questions on anything? I can kind of go over it a little bit if you want me to.
Maybe just a quick,
That'd be fine.
quick summary of it. Yeah.
Okay, so the front page is a checklist that any project that we're going to have that's going to require paying a contractor of any kind will have this sheet so that we can log what type of a project it is and the value of the project. If the work is less than 5,000, as a special district, we only need one bid. If it's between 5,000 and 24,999, we need 2 bids. And then anything over 25,000 requires 3 bids, and it requires us to do a public bid process. And then the last one is work that is an exception to this policy. And I was kind of thinking along the lines of a solar panel array that we've been talking about for our building. Maybe there's only one vendor or something. But if we do an exception statement, it would have to be approved by the board. This would mean that we wouldn't have to go out for bids for this particular project. The rest of this sheet is basically just the requirements of the contractors. And then this will be filled out, signed off on, and put in the file for future reference. The next portion of this is just to basically pre-qualify any contractor that we deal with, that they are going to be responsible for prevailing wages, that we require certified payroll before any payments made. Anything that they submit to us is FOIA-able. They have to list us as an additional insured on their insurance policies, their general liability, that they're an equal employment opportunity employer. And then there's the OSHA safety requirements, and then they can sign off on this and submit it. And the rest of this packet is basically back up to what I just told you on the other, a hold harmless agreement, the certified payroll statements, Substance Abuse Prevention on Public Works Projects Act that's put in this packet, and then a commitment to engage in affirmative action practices. The last page is what we're going to do to change our website. Currently, we don't have that we require prevailing wages, even though we have followed that for a long time, but we don't state that on our website. So this will be a very specific part of our website that contractors can go on and review our bid documents and anything that they need to know about doing work for us as a special district. Very last page is an advertisement for bids. Basically, this sets out how we will advertise for projects that we have, if we need to do that. And one thing I did not include, and I still need to write up, is an invitation to bid, so that contractors know what the work is that we are going to go out for bid for. Any questions on any of that?
Does anybody have any questions for Pat regarding this?
Yeah, I have a question.
Go ahead, Danielle.
Has the Equity Council taken a look at this proposal?
Unfortunately, all 3 of our people on the Equity Council, 2 have resigned and 1 is on an extended leave of absence. So no, they have not.
Resigned from CU Public Health or resigned
Yes.
from the Equity
Yes.
Task Force?
They have resigned from CUPHD.
Okay,
We are in the process of getting together some more people for the Equity Council, but right now we don't have an active committee.
okay. I would like to recommend, and just a little bit of background, this has been the issue of hiring minority and women-owned businesses in the community has been a longstanding issue of mine, and it's a longstanding issue in the community. Regularly, we go by public works that are being funded with public dollars, and there's not a single person of color on the job. And if there is, they're oftentimes relegated to holding signs, which I think was the issue on Windsor Road when the city of Champaign did that construction project. And there are very specific things that public bodies should do to correct that. I have brought those recommendations to the city of Urbana and to the county board, primarily in looking at, and so I would like us to do the same. So I'm going to recommend that we table this. I was hoping to engage with the equity task force in looking at this piece. But I'm also happy to work with the folks that I've worked on for a long time. You know, I've worked with Vasily Clark, who is a personnel director at the city of Urbana, and there are a number of people with expertise in this area. So that what I'd like to see, just so folks understand, is that in the reporting mechanism, so I appreciate that there's a affirmative action commitment. I think the commitment really doesn't have teeth in this case. And that the reporting requirements that are upfront in terms of ensuring that prevailing wage is paid should also include diversity statistics in those reporting. So there's a couple of other things that we can do, including assigning point systems to local contractors, assigning points to union, assigning points to minority and women-owned businesses to correct longstanding issues in hiring and employment practices. This is not new. There's a lot of public bodies that do it. There are models that I think we could take from this. This does include some of those pieces, but I'd like to go a little further if it it is agreed upon by board members. I'd at least like to have a second conversation before we move forward with this. And I certainly would be happy to do some of the legwork around making some recommendations in light of there not being an equity task force. So.
Thank you, Darlene. Thank you, Danielle.
I'm just wondering, is there a timeline to when you need to have this done, or is this just a regular update that we can do anytime during the year?
We have never followed the competitive bidding process. Our former attorney told us that we didn't have to, but when I researched it, I discovered that yes, we do have to do it. And so this is an attempt to get us, I know. So yeah, this is just a preliminary. Danielle, I'll be happy to help you on anything that you want my assistance on. This is really a first stab at this for me. So any insight that you can give me and provide, that would be wonderful. And I can work on that.
Yeah. I wonder if we can connect offline, but I wonder if, perhaps you and I and like a local area expert in this who often I brought in, if we could just circle up and have a conversation. It may need legal review by Ruth. But yeah, I really support competitive bidding. I definitely think if we aren't doing it and we haven't been clear about the prevailing wage piece, that this is already an improvement, what you're proposing, Pat. And I just like to take it a little step further around diversity and hiring and local hiring. I think, we give out a lot of money, and Andy and I give out a lot of money in public aid. And Darlene, when you were head of RPC, you put out a lot of money in public aid. But there's another way to help people, and that is to make sure that they also have access to local, good public jobs that pay prevailing wages, and we should be doing both. So I think public health can lead on this.
Agreed.
I think we could work on it and come up with something that everybody's happy with by maybe the next meeting, maybe.
Darlene, did you have anything else you wanted to?
I just want to add one more thing, because I do have some experience with this, with contracts. I would like to say that the city of Champaign actually has started, as you're probably aware, the CDAP program to try to build a pool of minority and women contractors for the very reason that we're short on those. And so when we're doing this policy, I would just like us to be cognizant of that. When we're doing pointing and things, we can certainly give additional points for those things, but sometimes there just aren't contractors out there that can meet those requirements. And so we need to be aware, we need to make sure the work carries forward and we're able to get things done. Yeah, I like the point idea. I would advocate for the point idea rather than saying it's mandated that we have to have certain things.
And I think it's also, that's really helpful, Darlene. We can check with the city of Champaign. I think Urbana has had less progress on it than Champaign has recently. But we should also talk to the housing authority, where all of their contractors, with very few exceptions, have been minority owned. And I can pull a list of the contractors from the housing authority, and they've done large scale projects. Now the question is, are they local? Are they not? I think we need to look at all of those pieces, but I think housing authority has done a lot of construction recently. That's a good model for how this could look going forward. So I'm happy to circle up, and I do understand that things need to move forward, and point system helps with that so that we can prioritize. We can also make sure that we have good outreach and when we have contract opportunities, to make sure that we're reaching everyone who could take advantage of that. And I'd love to talk to the city of Champaign about subcontracting, because oftentimes the newer entrance to the market, which may be minority owned, subcontract rather than be the primary contractor. And so looking at the subcontracting practices of our contractors is helpful piece. So yeah.
And I would like to say too, that I think it's not just, I don't know how much actual construction public health would be getting done, but it seems there are many other kinds of contracts that we might be interested in terms of consulting contracts, et cetera. So those might, and the city, I think, is also, at least Champaign and my office are looking at those things as well. So it's not just construction related things.
Mm-hmm.
And just to clarify, we do have for a very long time done prevailing wage, and we have required certified payroll. So we have done that for a long time. It's just, we have not advertised and done the competitive bidding, but the rest of that we have complied with. Danielle, would you like me to coordinate a meeting with some people?
Yeah, sure.
Who would you like to have on that?
Let me shoot you email and loop in, and I'd like to reach out to do you know who's playing point, Darlene, at the city of Champaign?
It's Rachel Joy.
Okay, so Rachel Joy, and then potentially somebody. I'm not sure if it's Lily at Housing Authority, but I feel like whoever maybe is second in command, who's over contracts. And then Vasilia Clark, who was over at HR in Urbana, I think it'd be helpful to the conversation.
And I'd be happy to help as well. We'd have to post those meetings though, if more than two of us, or if two of us or more are involved. I would like to note, I would echo everything that Darlene and Danielle both said. I'd really, really like to see a strong component where we do give points, and understanding that there are, of course, contractors that may not meet those requirements, or that there may not be anybody that would meet the requirements that we're trying to fill. But diversity, local, and union are all very important to me. And I think, I would go so far as to say the only way I would really support anything moving forward is if those were somehow, somewhere involved in our selection process, because I think it is important. And as everybody's noted, I don't want to repeat it. The city's done good work with that. The county has too. So I would also say, though, that what we're looking to try to do may not be as easy as we think. And so it'd be great if we can get it done in a month, but it's very, very possible we won't get this accomplished by next month. So I'd rather get it done right. Go ahead, Danielle.
Oh, I'm just wondering, Darlene and Andy, if you're both interested, if you have an interest in, which I think I very much welcome, could we then make it a study session? It's a public study session, and we can invite several folks to the table who are experts in this area.
Yeah, I think it would actually provide value to not only us, but the process as well, to just have an open forum. It's an important topic that, I think provides benefit to discuss publicly. So yeah, Ruth, that's appropriate, right? Okay.
So
yeah, I think
that we table this and have a study session on it with the board, and the public's certainly welcome and invited guests, and then we consider our options going forward. And yeah, I don't know if we'll have something by next month, but I think within 2 to 3 months with legal review, I think we could have it done by the end of the year for sure.
Agreed. Was that, Ruth, do we need a motion to table and go do a study session, or what's the best way to move forward? I think you're
You're
muted.
probably just a motion to set this over the next study session, or to set this, or you could table it to the next meeting, whichever you prefer, but something like that.
I think what Danielle just stated is sufficient. And, effectively, she just said, we're going to move this into a study session, have public discussion, and move forward from there.
Yeah, I
Yeah.
think that's fine.
Okay.
That represents my motion. Thank you.
Okay, and I will second that. Is there any discussion on the motion? All those, roll call, please.
Andy Cornstrom,
Yes.
Darlene Kleppel. Darlene, you're muted. Daniel Chenoweth.
Yes.
Thank you. That's 3-0. We're going to move this then into a study session. We can discuss it further.
Thanks
Pending-
Pat, for your work on this. I just want to thank Pat for the work getting us where we're at. So
Yeah, and I think we're probably very close. I think there's just some key points that we'd all like to see in there. And so, yeah, I would agree. Thank you, Pat. I know this is daunting. It'll be nice to have it done, though.
Yep.
I did not see any pending grant contracts for the administrator to sign. Did I miss anything? I'm guessing there's none. then.
Nope.
Okay. So the next study session, if needed, will be September 29th, 2021 at 10:30. The next monthly board meeting will be October 11th, 2021 at 4:30. We may squeeze in a study session regarding the competitive bidding package, and that will be posted appropriately. We have no other business. I would entertain a motion to adjourn.
moved.
All right, we have a motion, a second roll call vote for adjournment.
Andy Cornstrom,
Yes.
Darlene Kleppel,
Yes.
Daniel Chenoweth.
Yes.
Thank you. We're adjourned. It's 5:02. Have a great evening, everybody.
Yeah. Take care. We'll see
Thank
you.
you.
Bye.
Bye.